Let's look at some specialized tests that assess the motility and structure of gastrointestinal tract. So we are going to talk about the following test: SITZ marker test, endoscopy procedures, CT scan with contrast, rectal biopsy for Hirschsprung disease, full thickness intestinal biopsy. First, let's look at number 19, SITZ marker study. A 6 marker study is typically recommended if you have symptoms for chronic constipation and other tests have not determined the cause. The purpose of this study is to assess the colonic transit time by tracking radio-opaque markers through the colon. This test helps determine how quickly or slowly materials move through the colon. It is especially useful for diagnosing slow transit constipation. You swallow capsules containing radiopaque markers that can be seen on x-rays. For this one, no specific preparation is required. You will swallow a capsule containing markers, and over the next few days, x-rays will be taken in specific intervals, typically on days 1, 3, and 5, but the exact schedule may vary depending on the facility. Then the x-ray will show how long it takes for the markers to travel through the colon. And obviously, the normal result is markers pass the colon with the normal transit time. And you may have potentially minimum discomfort as it involves swallowing a capsule and undergoing x-rays. For this, non-invasive tests for GI motility are being developed, but the SITC marker study remains a reliable method. If the results are inconclusive, further motility tests like colonic manometry may be recommended. So this SITC marker study is to determine whether you have slow transit constipation. And if the capsule is taking longer to go through, then that means your gut motility is slow. And that's how study is useful to pinpoint whether slow transit constipation, whether gut motility is causing slow transit constipation. Next, let's discuss endoscopy procedures, which include colonoscopy, gastroscopy, and colonoscopy and gastroscopy. Procedures are usually recommended if you have symptoms like persistent abdominal pain, unexplained weight loss, chronic diarrhea, or blood in your stool. So, this allows direct visualization of gastrointestinal tract to assess for inflammatory and bowel diseases, tumors, ulcers, and structural abnormalities. These procedures can also be used to collect biopsies during the examination. So these procedures are essentials for diagnosing wide range of gastrointestinal conditions from colorectal cancers to Crohn's disease. So what is colonoscopy? It's about examining the entire colon. For gastroscopy is examining the esophagus, stomach, and first part of the small intestine. For preparation required, so fasting and bowel preparations are required to clear the intestines. Typically involves drinking of polyethylene glycol solution to cleanse the bowel. So we have talked deeply about colonoscopy because colonoscopy is one of the important invasive test mechanisms in the US and all over the world. In the United States alone, there are 16 million colonoscopies that happen in a year. So we created the entire playlist that goes from T minus 14 days to T plus 1 days, where T being the colonoscopy date. So there is a various preparation process. And we also learned that because of the inadequate preparation, there is a lot of cancellation, about 23% to 30% of the cancellations and rescheduling. And even when the colonoscopy procedure is gone, the it's inconclusive because of the inadequate preparation. So in order to resolve that, we have done two things. One, we have created an extensive preparation playlist. If you are going through colonoscopy, please go through that. We are going to link in the description, and you can find it in the Gutsphere channel as a colonoscopy preparation timeline playlist. It's a podcast, it's a video podcast. You can find it on Spotify and YouTube as well. So, and we also talk about different kinds of preparation solutions based on your existing conditions, based on your budget. We will be able to identify what's the right solutions for you. And also, when you go through this, which we have also learned that many people postpone the colonoscopy because of the anxiety. And I think, yes, anxiety is understandable, but when you understand what really goes into it, I think you can actually get through without exacerbating anxiety. So colonoscopy is done when through a flexible tube with a camera, which is called colonoscope, is inserted through a rectum to visualize the colon. The procedure usually takes 30 to 60 minutes. In the United States, you will be under sedation. I had gone through colonoscopy, I was sedated, and I didn't feel a thing. For gastroscopy, a similar tube endoscope is inserted through the mouth to visualize the upper GI tract. The procedure usually takes 15 to 30 minutes. I went through that, but there was no sedation available. It was mild discomfort because us typically fasting is required. So in comparison between colonoscopy and gastroscopy requires more preparation than the gastroscopy. After this, a doctor can take biopsies, remove polyps, and examine any abnormalities during the procedure. Obviously, the normal result that we're expecting for is healthy tissue with no signs of disease or abnormalities. When I went to colonoscopy, they found some some polyps, and they sent to a lab. It was benign, and I'm glad that at least some polyps were removed. For gastroscopy, they found that I had gastritis, and prescribed me the antibiotics to kill the H. pylori bacteria, which is causing some gastritis. Again, for colonoscopy, you may go get a mild discomfort. Uh, the discomfort is a little bit higher for colonoscopy because preparation is longer, fasting period is longer. You have to prepare for multiple days in advance, such as low residue diet, liquid diet, and fasting, no liquid at all. But for gastroscopy, the preparation is relatively minimum in comparison to colonoscopy. Maybe in the future, or as we talk about, there are non-invasive options such as virtual colonoscopy or capsule endoscopy are available, but they have limitations. But still, the gold standard is colonoscopy, and gastroscopy is also called endoscopy. And if this is inconclusive, then the gastroenterologist will prescribe more imaging tests or biopsies based on the initial findings. The next is going to talk about sigmoidoscopy. So sigmoidoscopy is usually recommended for routine colorectal cancer screening or if you have any symptoms like rectal bleeding or changes in the bowel habits. So difference between the sigmoidoscopy and colonoscopy is that colonoscopy is used for entire large intestine, but the sigmoidoscopy is only for your rectum area. It's minimally invasive of the sigmoid colon to detect issues such as inflammation, ulcers, polyps, and cancer. Sigmoidoscopy is less invasive than a full colonoscopy and can be used as a screening tool for colorectal cancers and other lower GI tract issues. Similar to colonoscopy, a flexible tube with a camera, sigmoidoscope is inserted through the rectum to examine the lower part of the colon. Similar to colonoscopy, fasting and bowel preparations are required. The sigmoidoscope is inserted through the rectum to visualize the sigmoid column. That the procedure usually takes 10-20 minutes, and the doctor can analyze, take biopsies, remove polyps, and examine any abnormalities. Obviously, the normal result we are looking for is healthy tissue with no signs of disease or abnormalities, and potentially this discomfort is less discomfort compared to full colonoscopy with mild cramping or bloating during the procedure. For sigmoidoscopy, sedation is optional. And obviously, if abnormalities are found, a full colonoscopy may be recommended for more comprehensive examination. So, sigmoidoscope is a lower rectum, which is minimally invasive. Colonoscopy is more invasive, and the endoscopy is for the upper GI tract. These are the endoscopic procedures that's going to help evaluate the structural assessments and specialized motility and more diseases that gastroenterologists are going to use to pinpoint the root cause or rule out. And if you are not getting any of these tests, please consult with the doctor. And one more thing which I want to add is based on your insurance, the cost may be variable. I have created a comprehensive deep dive about navigating the healthcare system so that you have to spend less and how to maximize a doctor's visit and so on. I'll link to that video. Please watch it. That's very, very important information because as chronic constipation patients or as chronic GI patients, we visit our doctors and we use insurance a lot, and and there is a financial burden or financial stress that's going to creep up, and being able to being smart to navigate the financial concerns, how to talk to insurance companies, how to get this test done. And the short magical word is it is medically necessary, and if you use it and you request your doctors to use it, then you may get this test prescribed for you at uh, insurance cost instead of being labeled as experimental. Next, we have CT scan, which is number 21, CT scan with contrast. A CT scan with contrast is usually recommended if other tests like endoscopy are inconclusive and if there is a need for further investigation because of suspected tumors or obstructions. So CT scans with contrast provides detailed images to identify obstructions, tumors, and other abdominal abnormalities. So this test is reserved for when other tests are inconclusive because of the radiation risk. So CT scans are offer cross-sectional images of the abdomen, making it easier to identify structural problems and other tests that might miss. The contrast dye improves the visualization of blood vessels and soft tissues within the abdomen. A CT scan with contrast involves using a special dye to enhance the image of the abdominal regions. So preparation, you may need to fast for a few hours before the scan. The contrast dye can be ingested orally or injected intravenously. You lie on a table that slides into a CT scanner. The scanner takes multiple X-rays images from the different angles, and the radiologist analyzes the images to identify any abnormalities. And one important note is people with allergies to contrast dyes should inform the doctor beforehand. And the normal result that we want is no obstructions, tumors, or structural abnormalities detected. And obviously, it is the mild discomfort from fasting and contrast dye, which can cause a warm sensation. The procedure involves exposure to ionizing radiation. So alternatives or follow-ups like if any abnormalities are found, further imaging test or biopsy may be recommended. So next, let's discuss the rectal biopsy for Hirschsprung disease, which is number 22, rectal biopsy for Hirschsprung disease. This is recommended. A rectal biopsy is recommended if a child has symptoms of chronic constipation and other signs that suggest Hirschsprung disease. So, Hirschsprung disease is a congenital condition that affects bowel movement, which diagnosis and purpose of rectal biopsy for Hirschsprung disease is to diagnose Hirschsprung disease where nerve cells are missing in part of the colon. A small tissue is taken, a biopsy is taken, which is a definite way to diagnose it by checking for the absence of nerve cells. A small tissue sample is taken from the rectum to look for the nerve cells. For this, no special preparation is usually needed. A small piece of tissue is removed from the rectum using a biopsy tool. This procedure is normally performed on infants or young children, and the tissue is examined under a microscope for a presence of or absence of nerve cells. So this test usually if the infant or the children have constipation, then Hirschsprung disease, which is a congenital disease with a lack of nerve cells in the colon, would be the suspected root cause. Then this test is advised for that. And also, if you have been having this chronic constipation since childhood, then maybe some doctors may recommend you can always discuss about these rare conditions with your gastroenterologist. And the discomfort level is very mild or slight bleeding at the biopsy site. In some cases, the imaging test may be used to diagnose Hirschsprung disease, although a rectal biopsy is still considered the most accurate method. And one more thing which I want to add for the endoscopic procedure is there may be a small bleeding because of the perforation. For example, when you're some gastroenterologist remove the polyps, then there may be a small bleeding, and that may cause some bright red stool or some bleeding from the rectum, and that will go away. And if that doesn't go away, you should definitely contact your doctor if when you go through this test. Now, number 23, if we are talk about the full thickness intestinal biopsy. A full thickness intestinal biopsy is usually recommended if there are severe motility issues that are not explained by other tests. So this diagnoses conditions like pseudo obstructions and intestinal neuronal dysplasia. So these conditions involve abnormalities in muscles or the nerves of the intestines, which can cause severe motility issue. A full thickness biopsy provides a comprehensive view of the intestinal wall. So a full thickness sample of the intestinal wall is taken to examine the muscles and nerves. For fasting may be required before the procedure, and the biopsy is usually taken during an open or laparoscopic surgery. This is a more invasive procedure compared to other options. The tissue sample is analyzed under a microscope to identify any abnormalities in muscles or nerves. And obviously, to rule out, we want a normal result, normal muscle and nerve structures in the intestinal wall. And there is slight discomfort related to the surgical procedure and the recovery time. And obviously, further test or surgical treatments may be recommended based on the biopsy result. So these are the specialized motility and structural assessments for gut motility issues. They are invasive test, non-invasive test. And this is mostly invasive test, and mostly it also requires surgery or going to the health system, so facility is more expensive. And we have to be careful because about the cost, because some of them may be covered by the insurance or may not be covered by the insurance. So one typical advice is get pre-approval, shop around. And again, let me remind you this: I have created a very comprehensive video about how to navigate the healthcare system. Please watch the video. The link is mentioned in the description. And again, most of these tests, maybe your gastroenterologist may prescribe you, or if you're not getting tested and you suspect any of diseases, you can always discuss with your the doctor for personalized advice and personalizing the treatment plans. Next is we are going to move on to segment 6. We are going to talk about another very specific conditions that can cause chronic constipation, which is pelvic floor dysfunction. And we are going to talk about different tests to diagnose pelvic floor dysfunction.